Walking is often called the perfect exercise. It's low impact, easy to do, requires no equipment, and has been shown to improve heart health, support mental well-being, and even lengthen life expectancy. Doctors frequently advise older adults to just keep moving and encourage daily walks to help maintain independence and overall health. However, recent research and clinical experience suggest that more is not always better. For some older adults, particularly those living with certain chronic health conditions, walking too much, too fast, or too intensely can actually do more harm than good. In this article, we will explore which specific health conditions might require a more careful, measured approach to walking. We'll also discuss how older adults can safely enjoy the benefits of movement without putting their hearts, joints, or overall health at risk. Why walking is generally beneficial before we talk about walking less. Let's acknowledge why walking is often encouraged, improves cardiovascular health. Walking strengthens the heart, lowers blood pressure, and improves circulation, supports weight management. It burns calories and supports metabolism, boosts mental health. Walking can reduce anxiety and depression, and improve cognitive function, strengthens bones and muscles. Regular walking helps maintain muscle mass and bone density, which can reduce fall risk, enhances balance and coordination. It improves flexibility and helps older adults stay steady on their feet. Given all these benefits, it might seem surprising to suggest that some older adults should walk less. But just as medication needs to be tailored to the individual, so does exercise. Health conditions that may require walking less. 1. Severe heart failure. Heart failure is a condition where the heart cannot pump blood efficiently enough to meet the body's needs. In severe cases, especially in older adults, overexertion from excessive walking can worsen symptoms such as shortness of breath, swelling in the legs, and feet, fatigue, and weakness. These individuals should not abandon walking completely, but must adopt a highly tailored plan. Typically, a cardiac rehabilitation specialist or a cardiologist can guide them on safe activity levels. Short, slow walks, even around the living room or backyard, may be sufficient and far safer than trying to reach high step counts. 2. Severe osteoarthritis or joint degeneration. Many older adults experience osteoarthritis, particularly in weight-bearing joints like the knees and hips. While mild to moderate walking can actually help lubricate joints and reduce stiffness, too much walking can increase joint pain, speed up cartilage degeneration, lead to falls or injuries due to weakened joints. Individuals with severe osteoarthritis might benefit more from lower impact activities such as swimming, stationary cycling, or aquatic aerobics. Even short, gentle strolls might need to be limited depending on pain levels. 3. Advanced peripheral artery disease. PAD is a circulatory condition caused by narrowed arteries that reduce blood flow to the limbs, often resulting in pain during walking. Claudication. Doctors often recommend walking through the pain in early to moderate stages, as this can help improve blood flow. However, in advanced PAD, when pain is severe, even at rest, or when wounds do not heal properly, excessive walking can be harmful. In these cases, a more conservative approach involving very short walks and frequent rest breaks is safer. 4. Severe chronic obstructive pulmonary disease, COPD. COPD, including chronic bronchitis and emphysema, makes breathing difficult. Walking can be a great form of exercise, but for people with severe COPD, even light walking can cause significant splitting breathlessness. Overexertion can lead to dangerously low oxygen levels. It can provoke anxiety and panic related to breathing discomfort. These individuals need to closely monitor their oxygen saturation and may benefit from pulmonary rehabilitation programs that include guided, supervised movement rather than unsupervised long walks. 5. Advanced diabetic neuropathy. Diabetic neuropathy damages nerves, especially in the feet. This leads to numbness, weakness, and an increased risk of foot injuries. For older adults with advanced neuropathy, walking long distances may worsen foot ulcers. They might not feel small injuries, leading to infections. Balance problems can cause dangerous falls. A podiatrist should assess foot health before recommending a walking routine. Protective footwear, gentle foot care, and short, Cautious walks are usually advised. 6. Severe balance disorders or frequent falls. Some older adults suffer from conditions affecting balance, such as inner ear vestibular disorders, advanced Parkinson's disease, certain types of neuropathy, history of frequent unexplained falls. Long or unsupervised walks can increase fall risk and cause serious injuries, including hip fractures or head trauma. Instead of walking alone, these individuals may benefit from supervised indoor exercise, balance training, or walking with assistive devices like canes or walkers. Understanding less in context. Walking less doesn't necessarily mean no walking at all. Instead, it means shorter durations. For example, 5 to 10 minutes instead of 30 to 60 minutes. Reduced intensity, slower pace, more frequent breaks, greater supervision, walking with a family member or physical therapist. Prioritizing safety, choosing smooth, flat surfaces, using proper shoes. The goal is to avoid overexertion while still reaping the benefits of movement. Signs that you might be walking too much. Older adults and their caregivers should watch for these warning signs. Increased fatigue lasting hours or days after a walk, persistent joint or muscle pain that worsens after activity, shortness of breath that does not improve with rest, dizziness or lightheadedness during or after walking, new or worsening swelling in the legs or feet, sudden or severe chest pain. Any of these symptoms warrant a prompt evaluation by a healthcare provider. How to find your personal walking sweet spot. Consult your doctor before starting or changing an exercise routine. Older adults, especially those with chronic conditions, should discuss it with their primary care doctor or a specialist. They can recommend personalized activity goals and refer to rehabilitation programs if needed. Consider a physical therapist. A physical therapist can design a program tailored to your abilities and needs. They can also teach safe walking techniques and recommend mobility aids. Use a step counter or smartwatch cautiously. While step counters can motivate some people, they can also push others to walk excessively. Older adults should use them as guides, not rigid goals. Alternative low-impact activities for older adults who need to limit walking. There are many ways to stay active. Chair exercises, seated strength or flexibility workouts, water aerobics or swimming, gentle on joints and good for heart health. Tai Chi or gentle yoga improves balance, flexibility, and mindfulness. Stationary cycling provides aerobic benefit without weight-bearing stress. The psychological side. Managing guilt and expectations. Some older adults feel guilty or lazy if they can't meet standard exercise guidelines, such as 150 minutes per week. It's important to remember exercise should be supportive, not punishing. Quality matters more than quantity. Listening to your body is a sign of wisdom, not weakness. A more compassionate, individualized approach often leads to better long-term outcomes and greater enjoyment. The role of nutrition and lifestyle. Lift walking needs to be reduced. Other aspects of health become even more important. Healthy diet emphasize fruits, vegetables, whole grains, lean protein, and healthy fats. Adequate hydration, especially important for heart and kidney health. Good sleep supports recovery and overall well-being. Stress management, meditation, hobbies, and social interaction can reduce cardiovascular risk. Family and community support. Older adults who need to limit walking may also feel isolated or discouraged. Family members can help by joining them in adapted activities, helping identify safe places for movement, encouraging smallest, joyful daily motions such as gardening or dancing to music at home. Communities can also play a role by providing accessible indoor walking spaces, supervised group classes, and supportive social programs. Real-life stories. Maria's story. Finding balance after a heart failure diagnosis. Maria, 78, used to walk briskly for an hour every morning. After being diagnosed with heart failure, she found herself exhausted and short of breath. Her doctor helped her create a new plan. Now she walks slowly for 10 minutes, twice daily, and spends more time doing gentle stretching and seated exercises. She feels stronger and more confident, and hasn't had any hospitalizations in over a year. Sam's story. Coping with severe arthritis. Sam, 82, loved walking to the local park, But his severe knee arthritis made this increasingly painful. His physical therapist introduced him to aquatic exercises, and now he goes to the community pool 3 times a week. He reports less pain, better sleep, and no longer fears falling on the sidewalk. Linda's story, dealing with neuropathy. Linda, 75, lives with advanced diabetic neuropathy and had developed foot ulcers from long walks. Her podiatrist advised her to shorten her walks drastically and focus on chair yoga and gentle stretching. Today, her ulcers have healed, and she remains active without risking further injury. When to consider stopping walking altogether. In some rare cases, temporary or even permanent cessation of walking may be necessary. This may occur if severe, unmanageable pain persists. The risk of falls is extremely high despite assistive devices. Severe wounds or ulcers require offloading and rest. In these cases, a healthcare team can recommend alternative activities and ensure that mobility is maintained. SAF.